Learning how to push correctly in labor during your pregnancy is one of the most important skills you can learn. Learning how to push correctly in labor during your pregnancy is one of the most important skills you can learn. Why? To prevent problems such as urinary incontinence and pelvic floor problems such as a prolapse of your uterus, bladder, or rectum. A prolapse is a downward descent of these organs, sometimes outside of your body. As a childbirth educator, I know that pregnant women are not taught how to push. Pushing in labor is a learned skill and must be practiced during your pregnancy so it is then second nature in labor. You cannot have a nurse teach you how to push when you are in pain. I'm Julie Tupler, creator of the Tupler Technique, a research and evidence-based program to treat diastasis recti. I started working with pregnant women in 1990, preparing them for what I call the marathon of labor. To be able to push effectively in labor, you need to strengthen your abdominal muscles, make your diastasis smaller to keep your uterus in the correct position, learn how to isolate and separate your abdominal muscles from your pelvic floor muscles, and then practice pushing while having a bowel movement. That way, when you get to labor, you have trained yourself to push with your strengthened abdominal muscles while relaxing your pelvic floor. This type of pushing not only gets your baby out faster, but it protects your pelvic floor from the prolapse I mentioned earlier. So if you are pregnant, the most important way to prepare for labor is to learn how to push either before or during your pregnancy. If you want to learn more about closing your diastasis with the Tupler technique, click on the link below to get a free copy of my Tupler tips. Thanks for listening.